So first we get to welcome back Dr. Ohoro to give us an update on hospital-acquired pneumonia and ventilator-associated pneumonia guidelines. And I can't remember if we mentioned it before, but he's board certified not just in infectious disease, but also in critical care. So he's got the expertise to update us. Thanks, Jack.
Well, thank you. I'm going to be giving a little bit of my critical care knuckle dragger's guide to ventilator-associated pneumonia here today as we go through. And we'll start with our audience response question for today. How long is the optimal treatment for ventilator-associated pneumonia? Is it A, 3 days, B, 5 days, C, 7 days, D, 10 days, or E, it's organism dependent? Okay, good. The majority of you got that it's now 7 days across the board, and we'll talk a little bit about the organism-dependent piece and where that's gone in the recent past. So when we look at the definitions for the healthcare-associated pneumonias, they're fairly straightforward. Hospital-acquired pneumonia is any pneumonia that has an onset greater than 48 hours after admission in someone who doesn't have an ET tube in place. If they do have an ET tube in place and the pneumonia occurs 48 hours after that, they're in the ventilator-associated pneumonia category. There's this newer term in the past 4 years, ventilator-associated event, that I'm sure that people who do infection control are probably more familiar with, but it's not having any translation into a clinical setting at this point. It's really just a surveillance definition. So we won't really be covering that today, but just aside from mentioning that there. You may require from the old guidelines, there was this lengthy definition of HCAP, this pneumonia occurring within 90 days of contact with healthcare. In the most recent guidelines, that's been nixed out of that, mostly because a review of the evidence suggested that the patients who were in that HCAP category actually had a lot more in common with community-dwelling patients with some risk factors for for multi-drug-resistant organisms than the healthcare-associated type organisms. So for 2 years, I've been giving some version of a HAP VAP update talk to various audiences, and each time I always say in the fall, we're supposed to get that updated CAP guideline that's supposed to discuss where HCAP went. And I'm going to be saying that again because it still hasn't come out yet, and that's the last answer I got, is look forward to this fall. So talking about these pneumonias, overall the pathogenesis remains the same to any other, where it's thought to be microaspiration of oropharyngeal flora. And it's thought that that 48-hour time period is what it takes for the flora to start to change over to reflect more of the hospital organisms and the patients being more vulnerable because of their